Right. Welcome, everyone. I'm Adelina Comas Herrera. I'm delighted to welcome you to this webinar today. This is a Global Observatory of Long-Term Care webinar, and it's the very first one of the interest group on innovation in long-term care. We're delighted to be hosting it. I'm going to briefly introduce the observatory, and then I'll hand over to Juliet Mali and Cheryl and Tracy, who will do the presentations today. So the Global Observatory of Long-Term Care is a platform to share knowledge about long-term care. And the idea is that we can support cross-national learning to improve and strengthen care systems. It's part of the long-term care policy network. And we are conscious that there are many shared challenges in long-term care and also many innovations that can be shared around the world. And we're delighted to facilitate these collaborations and exchanges. And you can use the observatory in many ways. One of the ways is through publishing country profiles. The other is through blogs. We're also publishing methods and topic guides. And really at the heart of the observatory are the interest groups like the one today. And each interest group organizes their own series of webinars, and they also get their own webpage where they can share relevant publications and resources. And we're gradually building up a database of experts. We already have more than 660 people, and you can find out about their interest, expertise, topics. And we are also building up a database of publications on long-term care, research projects, and videos of previous webinars. And we will record today's webinar as well, and will also be accessible. I would like to make sure that you are all aware that on Friday we have a whole day event called Changing the Narrative on Long-Term Care. It starts in Australia, and then it will travel through Europe all the way into Chile for the end of the day, and we'll have presentations to help us think how through research and evidence we can change what has been, we think, quite a negative narrative about long-term care, and we'll be challenging some of the negative myths about sustainability, about the workforce, about healthy aging, about the value of care throughout the day. So please, if you haven't joined us yet, please do, and I'm sure we'll have the link on the chat. And I'd like to also invite you to our next webinars. We have one on the 1st of December from the Economics of Long-Term Care group, looking at evaluating long-term care in different countries. On the 10th of December, that's one for the qualitative interest group and data science interest group, looking at the use of AI and large language models in qualitative research. On the 14th of January, we'll be looking at the impact of changes in migration policies on the social care workforce in the UK. 2nd February, sustainable continence care in long-term care, and 5th of March, joint pain in long-term care and qualitative methods webinar. And we'll be announcing more webinars soon because the interest groups are very active. And this is a reminder that if you haven't joined the observatory, please do. It's not enough to say that you'd like to join an interest group. You actually have to create a profile. By creating a profile, we know about you. We can also show people what your experience, expertise, and knowledge is. And also you can see which topics you're interested in. So please join us if you haven't done so yet. And with that, I'm going to stop sharing, and I'm going to hand over to Juliet, who will introduce this new interest group on innovation in long-term care.
Yes, hello everyone. So welcome to our first meeting of the new interest group on innovation in long-term care. So I'm just going to get up my slides because I just think it's useful if I can find them. Yeah, so Cheryl and I set up this interest group in innovation in long-term care. I've been encouraged by Adelina to do so for some time now, so very glad that she finally encouraged me enough that we got together and set this up. So the idea of the interest group is really to bring together academics, policymakers, and practitioners to advance understanding and practice of innovation within long-term care systems. Particularly, we're interested in that question of how innovation can really be harnessed to transform long-term care. This is a problem that sits across all systems, long-term care systems, lots of challenges that we're facing. So how can we transform innovation, use innovation to transform long-term care? So we've organized the interest group around three sort of interconnected streams of activity, which I've put up here. So hopefully you can see. So the first is sort of more of a conceptual stream, thinking about examining the nature of innovation in long-term care and trying to understand what that looks like, whether it's different from other contexts, and thinking about how that can then be used to kind of drive innovation, scale up, sustain innovations, and perhaps spread innovations. We also want to be able to showcase real world examples of innovation in long-term care. So there's a huge number of things going on across different countries, sometimes quite similar. So a real opportunity to share what's going on and perhaps make connections where you're doing similar types of innovations, perhaps with quite different results, perhaps because of the different contexts, to really try and learn around that. And then finally, there's a strand that's perhaps a bit more critical, thinking about how we can develop strategies for more frugal, inclusive, and equitable innovation, really an opportunity to question who innovations are designed for and whether they can reduce or whether they reduce or perhaps exacerbate existing age-related or disability-related inequalities. So an opportunity for something a bit more critical. And I think the real opportunity of this interest group is it's global, hopefully, in its reach. And through that, we can potentially use that sort of comparative approach to really advance our understanding, reimagine long-term care systems, and enhance policy and practice. So how we're sort of proposing that it works initially, at least, is we envisage a series of webinars to share the research that's going on across different countries, make connections with others that are interested in this topic. But we're also really hoping that this group can become a vehicle, perhaps more comparative research, to really bring different ideas to this question. But we're really open to suggestions, I think, from you as to how we could use this group to mutual benefit. So Cheryl Tree and I are currently on the steering group for this interest group, but we're really keen to have more people join us. So we're keen to have a very sort of globally broad steering group. So if you're from another country around or different part of the world, please do get in contact with us if you're interested in joining the steering group. So in terms of what we thought we'd do for this first session, we thought we'd kick off with some of our own work around innovation, but we don't want it to be all about our work, and we're really hoping that people will join us and get in touch and suggest other speakers for future webinars, also perhaps topics that you're really interested in hearing more about. So again, do get in touch if you have ideas for future webinars. So in terms of today, we've got a couple of presentations. So myself from my work, which is entitled The Innovation Journey Revisited, and I want to propose that this could be a unifying frame for guiding innovation in long-term care across a range of contexts. So that's a much more conceptual piece of work, sitting really more within that first stream that we mentioned. And then Cheryl and Tracy will be examining an example of innovation from the East, the case of Timebanking in older adult care. And that obviously fits a bit more within that second strand. So we're thinking will be about 20 minutes or so for each presentation. Might be a little bit longer, but we should have plenty of time for questions. Okay. And yeah, so I will immediately jump into the first presentation, which is going to be me. So, as I mentioned, the title, The Innovation Journey Revisited. So this paper really emerged from a 5-year ESRC funded research project that we actually completed last year, which is entitled Supporting Adult Social Care Innovation. So there's various different resources on the web, and there'll be a link at the very end of this presentation for you to explore those. So I've put a little note to myself that I should say what I mean by adult social care, because I'm going to be talking about that quite a lot rather than long-term care. But essentially in England, adult social care is really largely the equivalent of what would be called long-term care in other countries. So it includes long-term services and supports for older and disabled people. So in terms of paper, I just want to say I'm still refining this and playing around a bit with how to present it. So I'd really welcome your ideas and thoughts on what I'm going to present today. So thought it'd be useful just to give a little bit of background and then give you the aims and set out how I'm going to approach this presentation. So in terms of background, as I mentioned indeed in the intro to this interest group, there's a real need to transform adult social care or long-term care, and innovation is absolutely seen as key to achieving that ambition. A real challenge, at least in the English context, but so I understand in other contexts too, is that we see a kind of failure, however, of innovations to really sustain, scale up, and spread. And certainly the UK government sees this as a key challenge and is really interested, therefore, in understanding much more about the process of innovation, really hoping that with a better understanding of that process of innovation, this will help policymakers, but also organizations, social care organizations, to have greater success in sustaining, scaling, and spreading innovations. So I just wanted to be clear because I'm focusing on perhaps a different model and suggesting a different model for thinking about innovation as context, is that I absolutely recognize that there are many innovation models and frameworks out there. So I suppose the question you might have is, well, why not look at these? Why, suggest something else? And I think the answer to that, and part of the kind of drive really for the project in the first place, was that none of the models and frameworks that are out there really specifically developed for the adult social care or indeed long-term care context. We do find that many of these different models and frameworks are used to understand and explore innovation in long-term care, but often there's no explicit justification for the choice of the model. And though few studies really kind of critically consider the applicability of the models to this context. So we saw a real opportunity to try and do that, to try and think about the applicability of these different approaches to thinking about how the innovation process happens to this particular context. So what I want to do with my time today is outlined in the aims. I want to outline to you the three types of innovation journeys that we've identified within within the adult social care context in England. And then what I want to really do is make the case for using this concept of the innovation journey, and I'll talk about that a little bit more in the next slide, as a unifying frame really for exploring innovation across a range of contexts. So we have this broad idea of innovation journeys and a particular model that describes that. And within that, we're suggesting that there are different types of innovation journeys that follow that same broad path, but have some slight differences between them. So what I want to do is I'll take you through this in several steps. So first, I just want to look a little bit more at some of the theory that sits behind this. So I'm particularly drawing upon Van der Ven's work on innovation journeys, but also some work by von Hippel about different sort of functional sources of innovation he talks about. And I'll think about how those ideas translate to the adult social care or long-term care context. Then I'm going to describe to you the three different journeys at sort of fairly high level and looking at how some of the processes around innovation differ, really focusing on one particular area of relationships. And then I want to just really round up by thinking about the value of presenting this different approach and the implications of these different types of journeys for leaders or sort of leading organizations that are leading innovation, the strategies that means for them to adopt for innovation success, and indeed implications for research and policy more broadly. So the innovation journey. So this concept and the model, which you can see in the diagram, comes from, as I mentioned, the work of Andrew van der Ven and colleagues. So what I really like about this model is it's empirically grounded. It's based on a very large number actually of case studies from different industries, actually healthcare, tech, various different industries. And it's also been applied to social innovations from a number of kind of contexts as well. Now, the thing that I really like about this model is a centrality of uncertainty to it. So what we read when we think about innovation, it's an inherently really uncertain activity. And this kind of model and Andrew van der Ven's work in general really puts that uncertainty at the heart of how we think about the innovation journey. So the key points it makes about the innovation journey is the fact that it's a really messy and non-linear process that's capturing that uncertainty. The process doesn't unfold as we often think in a sort of simple linear sequence of stages and substages. So you'll be familiar with a kind of stage gate model of innovation. It doesn't proceed in that way. Instead, what we often see is this kind of proliferation of ideas and sort of divergent exploratory activities with people going off in various different directions to explore different avenues and possible solutions to projects that emerge so problems rather that emerge as the innovation evolves and proceeds. The important part, though, to sort of qualifier to that is that although it's messy and non-linear, it's not random and chaotic. There are common elements, which you can see outlined actually in the diagram with the kind of numbers. So this period of gestation, for example, the idea that there are lots of setbacks, and so on and so forth. And there's also a developmental progression that you see within the journey. So broadly understood as three phases: a phase of initiation, a developmental phase, and then an implementation phase. The other point that he makes about the journey, which again comes back to this idea of uncertainty, is that it has a particular dynamic to it, which he describes as this non-linear cycle of divergent and convergent activities. So you can see that to a degree in the model, the process model that's illustrated there. The divergence with people going off in different directions, but then the realization that perhaps some of those avenues that have been followed are not leading anywhere. They need to be closed down. And there's a kind of convergence on one particular path moving forward. And that can continue multiple times. But the key point about this is then this dynamic of divergence and convergence really underpins all of the core activities that you see happening with innovation. So the key things that we know that are important from innovation and really come through in this innovation journey work too is the importance of learning, the importance of leading and leadership, the importance of different relationships and building those relationships with different individuals and organizations in order to kind of facilitate the innovation process. And also then thinking from more of a macro view about building a sort of infrastructure or ecosystem that sustains the innovation. So all of these activities are really important, and we see this, but there's also a need then for these activities to respond to that particular dynamic. And he's able to describe then the particular character that's of learning that's important, the particular character of leading that's important. So for example, for learning, he talks about the need for learning to be more adaptive, with phases of which you see learning by discovery. When you're in this more divergent phase, there's a lot of uncertainty around the directions, and then moving into learning through sort of testing during the phases where you're sort of going through something more convergent. And similarly, the need for leadership leading to be more dynamic and pluralistic to reflect the fact that, you know, leaders need to be taking the organization and developing them and leading people in different ways depending on the phase of where you are in that kind of cyclical, convergent and divergent phases of thinking. Okay, so just thinking then about the applicability of that model to the adult social care context, what we have is really good evidence, I think, from a review we undertook that this model applies well to the social care context. So we undertook a review to understand what helps to develop, scale, and spread innovations in social care. And we identified 5 themes from the literature, which, as you can see, have good read across to the key activities that we just noted in that model. So the leadership aspect, learning, and collaboration, which I think really picks up on this idea of managing relationships and infrastructure ecosystems, which I will develop more as we go. See, I haven't mentioned when I was talking about the model, the idea of resources, but obviously these are critical to innovation, and culture. But I would say when we were picking out this theme of culture from the work that we were doing, from the review and the experiences of people in adult social care, often culture is used in quite a sort of vague and loose way, and really reflects sort of approaches to learning and approaches to leadership. So it has quite a lot of overlap with that. So I'd say the key sort of limitation really of this review, or the key lack of or problem that we found when we reviewed this literature, was that we really lacked a sense from the review of how to do all of these activities around leadership, learning, in the context of innovation, within social care. So often what we see is that articles would note the importance of these dimensions, but they provided very little insight into how to lead, what leadership looks like, what learning looks like. So a real opportunity, we thought, to develop a much better understanding of what are kind of really key activities, as an understanding of how these activities need to be implemented, need to be done, could really help people within the sector. Okay, so I mean, I've mentioned so far that the focus of the innovation journey work has really been on demonstrating the similarity of the innovation journey across contexts. And Van de Ven, and indeed I'm kind of arguing that point as well. Van de Ven has shown this through his work, but others have also, as I mentioned, applied the innovation journey to other contexts too, and shown that it's been incredibly useful as a way of framing and thinking about innovation. But I suppose the question then that sort of sits at the heart of this is, well, how do we square this fact that innovation looks very similar across all these different contexts with the fact that there are a multitude of innovation literatures out there that distinguish different types of innovation? So I'm thinking of social innovation, public sector innovation, various different models from the healthcare context that really argue that innovation actually is fundamentally different across all these contexts. So what's quite interesting is when you look in a bit more detail about all the work that has been done around innovation journeys, is that we see that actually the innovation process across different organizational settings, structures, and contexts, we do find that actually not all those elements that I mentioned of the innovation journey are quite as important. And there's a degree of variation in those different elements. So Van de Ven very much argues that this is a variation by degrees, and I would agree with that point. But it does perhaps open the door to building the idea of different types of innovation journeys into this kind of broader sort of frame of Van de Ven's of the innovation journey that are perhaps differentiated by organizational setting, structure, and context. And indeed, that's what we do in our work. So when we thought about translating this idea to the adult social care context, I think a key question for us really was whether the adult social care context is a single context or perhaps actually multiple contexts. And so I've put this diagram, you can see, of the adult social care context in England. I'm not going to go through it. It's very complicated. There's a reference there, so you can look at this at your leisure at some time. But it's quite a nice paper actually really describing how the adult social care context, how it works in England. But what perhaps you can get a sense of from just looking briefly at that diagram, if it doesn't kind of blow your mind, as complicated diagrams often tend to, is that we have quite a complicated context in England. We have a mixed economy of financing and delivery with the involvement of lots of private, public, voluntary and community sector providers. Private individuals are also involved, purchasing care and carers. So my instinct very much was that actually this is not a single context. There are multiple contexts sitting here, and then potentially multiple innovation journeys. And indeed, this is what we want to argue and illustrate. So the next point then is really how to think about what those different innovation journeys might look like. So we kind of developed this from our work, but we've really needed to think about, well, how can we help people to orientate? How can we help people to think about, what type of organization they are and how they connect perhaps to these different journeys? So what I found really helpful for developing this idea of different journeys and how they kind of connect with, different types of organizational structure, setting, and context is von Hippel's work on user innovation, and particularly his concept of sources of innovation. So what he notes in this work is that we tend to think of sources of innovation as really lying with producers. So in the context of perhaps products, you think of manufacturers and suppliers as being that source of innovation. And in the case of developers and suppliers, perhaps in the case of sort of service or more process innovations. But what's quite interesting about von Hippel's work is he really shows across many industries actually that users are often the source of innovation. So I think this just opens us up to thinking about the sources of innovation in a different way, and identifying perhaps different groups of innovators defined according to, as von Hippel talks about it, their functional relationship to the innovation. So the relationship through which they derive benefit from that innovation. So he talks about if people benefit from using it, then they're users. If they benefit from manufacturing it, then they're manufacturer innovators. If they benefit from supplying the components or tech or service or so on, then they're a supplier innovator. So what I've tried to do is map this out a little bit against the diagram that I showed you earlier. And what I particularly want to point to are these different types of users. So the blue circle that's highlighted on the diagram, these are our kind of classic end users. So the people who are paying for their care, people who are drawing on care services. Then the green circle highlights the care providers, and they're really involved in the care delivery. So they can sometimes be a user of innovation if they're perhaps developing or adopting an innovative tech product and integrating that within their organizational processes, then they're benefiting from using it. They can also be a supplier if they've developed a new sort of way of delivering care, then they would benefit from supplying that. So they have a kind of, complicated position as part user, part sometimes supplier. Similarly, local authorities have a sort of more complicated relationship here. Again, they can potentially be users if they're adopting perhaps an innovative tech product and integrating that within their organizational processes, then they're going to benefit from using that product. But the way they work, because of our separation between purchasing and providing, local authorities really have a key role in care management and also market management. And through that, they're really intervening in the supply of innovations to publicly funded end users and also people in the local area more generally through their commissioning and market management decisions and also care management decisions. So if they're kind of developing or adopting innovation in that space, they're not benefiting financially because, from supplying that because they're a public body, but we would expect them to be deriving some kind of benefit through doing that. So again, a slightly complicated relationship and position that they hold within the system. So what we took from this, and the key message, I suppose, to take from this really is that we don't just want to, and we didn't just want to in our work, look at those producer innovators. So people that are sitting on the outside supplying innovations to the market. We also wanted to look at those organizations that sit in those kind of more complicated spaces. So particularly the care providers and the local authorities. So performing these quite distinct roles within the system, but also can be both kind of users and suppliers to some degree, complicated in the context of local authorities, of innovations when they're leading that process. Okay, so just to take you very quickly through the design of the research and the methods. So we had multiple case studies of adult social care innovation process. We selected our case studies according to the diversity in the stage of the innovation process, the types of innovations, and indeed those lead organizations or source of innovation, as I've just been talking about. We had a slightly complicated structure of the case studies, which I won't go into because it depended on the type of case study that we're looking at. But essentially, we were really focusing on that innovation process, looking at the role of lead organizations, but also looking at specific innovations as well and tracing those. We use multiple methods, so interviews with strategic and operational reads, observation, documentary analysis. We had witness seminars for one particular type of innovation, and we took both a kind of retrospective and prospective approach to data collection. So looking back, but also following these innovations and these organizations over time. The data was collected between 2021 and 23, sort of four. Obviously, the pandemic was happening, or in the tail stages of it over that time. That really affected what we could do with data collection, especially where we were working with care provider organizations, because those restrictions stayed in place for some time, and the capacity was also obviously badly affected. So that kind of limited really what we could do in terms of observation within those sites, but also a degree to which we had access to individuals to interview them and so on. So those are perhaps not as developed as they could be, but I think we still got a good amount of insight from all the work that we did in the case studies. And then in terms of analysis and synthesis, we took a sort of narrative, structured approach to developing case study reports. And then we really had this very iterative process of developing these groupings of the three different innovation journeys through discussion, but also tabling of some of the key concepts, those key activities I mentioned of leading, learning, and so on, to really compare and contrast the different journeys. Okay, so the case studies we had, I won't go into in detail, but you can look at them more online. But we had a couple of different care homes, essentially. So Springfield and WCS. One was for profit, one is not for profit. We had Equal Care, who are a home care co-op, actually kind of real startup type organization, providing a very different type of home care to the market. We have Shared Lives, which I'm sure some of you will be familiar with, which has been going for some time now, achieved really quite a lot of spread. It's like a form of adult placement. And then we had two that were led by local authorities, so Better Care Together Thurrock, which was an approach to changing the way care was delivered to be much more preventative and integrated across the local care and health indeed system. And then the London ADAS innovation, which was kind of an extension or really evolution of a data-driven approach they've been taking to commissioning across all of the London boroughs. And that evolved into a data-driven approach for managing the COVID pandemic. And then we also had a witness seminar on the Ordinary Lives initiative, which was where people were being helped really to move out of hospital into the community. And that was many years ago now, but has been kind of continuing through. Okay, so what I wanted to do as we move into the findings is just give you a very high level overview of the three types of innovation journeys. And then what I want to do is go into a bit more depth about how they differ according to one key activity of the different relationships and the kind of management of those relationships. So just to give you a very kind of high level overview, we have our first journey, which is a business model innovation. So I should say these diagrams, you can find them online and you'll actually be able to read them there. That's not the intention that you're able to read them here. So the business model innovation, which is essentially mainstream care providers who are developing their business model, aiming to improve their offer to clients and the workforce. That point about improving the offer to the workforce is really important. They're doing that by leveraging built environment innovations, but also tech innovations. The goal that they working towards is improving the care and lives of the clients and the workforce. And a lot of this is also about maintaining competitiveness. So the second type of innovation journey was our what we've called systems innovations. So these are led by local authorities. They involve many organizations coming together around a common vision for an area and collaborating to modify or transform provision and its delivery. The goal is about improving the care system, the lives of people in the workforce, but there's also a kind of narrative around saving money, doing more with less, sort of being a more sustainable system. And then the final journey is what we call social innovations. You'll see obviously a connection to literature I'm sure you're familiar with. And these were really where we had people and organizations that were working together to transform the care system from the outside by reinventing and developing new forms of care businesses and services. The goal is really much more transformational, transforming people's lives and seeking to really transform how care is delivered. So I don't have enough time to go into the detail of how these vary across all the different sort of activities that you would see happening for innovation, so leadership, learning. There are smaller differences there, I would say, than there is in the aspect of relationships. Hence the idea to focus on the relationships to illustrate to you the kind of diversity and how these innovation journeys look different across these three different types. So the first innovation journey I mentioned is the business model innovation. So both of the examples that we had in this type were organizations that were implementing kind of multiple tech and non-tech innovations over a kind of a period of many years, really. So what we saw in terms of the relationships that developed over that time were, in both cases, we saw quite a lot of dyadic relationships developing, with really two key purposes. So they were developing with relationships who were with organizations that were offering sort of specific capabilities that might facilitate innovation. So there was an example of a university research partnership. So bringing skills and kind of analysis and research that weren't there within the provider. But there were also relationships with suppliers, so people supplying perhaps components or, elements or innovations. So a building contractor where they were developing care villages, but also to lots and lots of different tech suppliers providing specific bits of tech to support them with different parts of the care delivery. So what was really quite interesting when we looked at this a little bit more was that because while a lot of these relationships were kind of broadly contractual or sort of partnership type relationships, because these organizations were often early adopters, the dyadic relationships that we saw were often kind of evolving to becoming much more sort of two-way, mutually beneficial relationships. And in some cases, they'd actually evolved into relationships with multiple different parties to achieve, certain different things that you can see in the next point there about developing specific innovations, but also trying to sustain and spread these innovations. And I think the reason that we saw these develop is because they were early adopters. What we found is that they were facing very novel problems around how to integrate these innovations within their estates and indeed integrate the different types of innovations with each other. And this required these organizations to innovate around solutions to those two problems. So we saw this kind of, if I just kind of take you through some examples, particularly with the WCS case. So one of the quite interesting things we saw is that in order to retrofit some of the tech across their estates, they really needed wireless versions of the tech that didn't exist. So in one of the relationships with one of the suppliers of the acoustic monitoring system they managed to convince that supplier to develop a wireless version of the kit that they then could retrofit. So you can see there that that's a kind of contractual relationship that's then moving into much more kind of mutually beneficial relationship. They didn't manage to do the same thing with the circadian lighting systems, and they couldn't convince the circadian lighting system supplier to change. So they decided to develop their own innovation there. And that's where we saw them then developing all these relationships with researchers, lighting specialists, lighting designer to actually develop a wireless version of that piece of tech. So that was quite interesting. Another thing that we saw was quite interesting was the particular concern that they had around being early adopters was that the suppliers might fold. So there's a big risk to them there. And what we saw them develop in one case was this innovation hub. It was completely unplanned. It came because the director of the acoustic monitoring system asked the provider if they'd be willing to be a sort of demonstration site. And part of this was about really building that market for this, new type of monitoring that they were the first ones to have adopted in the whole of the UK. And they agreed to be a demonstration site, and they invited other care providers in to see how it was working. They started to have lots more tech providers really interested in demonstrating their technology. It brought a huge number of advantages to WCS, but they actually stopped discontinued the Innovation Hub after a while because they really decided that it stopped bringing that benefit to them. So you can see it's quite temporary, huge webs of relationships, but temporary to some degree based on the value to the organization of them. So in the systems innovations, we see something that looks quite different in terms of the relationship. So in both of our cases, these were led by local authorities, as I mentioned, again, introducing multiple innovations over time that involved lots and lots of other organizations in the local area needing to really implement them over a period of time. So here instead, rather than there being these kind of dyadic relationships evolving initially, what we see at the start is a web of different relationships and organizations between lots of different organizations in the local area that are absolutely essential to launching the innovation, implementing and sustaining the innovation. So we saw a partnership in the Thurrock site, for example, that was there from the beginning between the third sector, communities, the NHS and the council. So really critical to get it going. Then you see dyadic relationships that are merging around this with specific individuals who are offering specific types of knowledge. So, for example, we saw lots of relationships with thought leaders developing who are helping to accelerate the kind of local development and learning around specific innovations that they were implementing. We also saw relationships developing with where organizations were able to offer specific capabilities. So university researchers, for example, were brought in to help with some of the kind of evaluatory activity, for example. And indeed, we saw relationships developing with, suppliers, so suppliers of tech products and so on. So a very different set of relationships developing with different purpose. Then finally, in the case of social innovations, again here, so these in all cases started really with some individuals coming up with an idea, putting it into action as a kind of new service or form of service. So what we saw here instead was initially a kind of web of relationships, but between individuals, and everyone talked about it as like-minded individuals. And these people were really critical to gestating that idea, thinking about how it would work and launching the innovation. Then we see lots of dyadic relationships developing where individuals are offering specific resources and capabilities. So we saw examples of a software developer, researchers, and then organizations offering specific resources and capabilities. So funders were particularly important, membership bodies, different people are able to kind of offer lots of advice and support around particular aspects in order to really grow and evolve the innovation. And then what was quite interesting as you move more to sort of implementation and later phases, is that the actually would move from those webs of relationships with individuals being important to webs of relationships with other organizations being really critical. So this was where we saw organizations that were quite similar coming together. So they were trying to do quite similar things. They were perhaps using very similar types of models. They were experimenting around the challenges that they faced, which were quite similar. They were learning from each other. And indeed, in the case of shared lives, which is quite interesting, you see them developing evidence together and standards to kind of really try and standardize that model. But the other thing that you see that comes and the real value of this web of relationships comes when the environment around them changes. So they're a real opportunity, think in a sort of social movements type way, of allowing the organizations to really campaign for change to the system to create a much more supportive environment that's much more receptive to that innovation. So a very good example that we saw from Shared Lives was there was in 2000 there was the introduction of a Care Standards Act, which tried to regulate shared life schemes like care homes, and actually started to lead to the closure of lots of these schemes. So they campaigned together to change the regulations, and they succeeded in getting them changed in 2004. So really important then in creating that kind of much more receptive context. So hopefully what I've done, hopefully I'm not going on too long, I am coming to an end, is demonstrate that there are those different relationships. And I guess the question then is, well, what do these different relationships mean for people? So I think what we see with the business model, I've shown that there are these multiple relationships that are largely transactional and independent, but the webs of relationships that develop too are also transient. What I would argue is that there's some evidence from the data we've collected that insights from sort of more the business literature are really valuable as thinking about what could be strategies for success in this environment. So identifying and managing relationships based on need and opportunity is really the key strategy here. For systems innovations, I've shown that managing that web of relationships is really central to launching, implementing, sustaining the innovations. What I argue from our evidence again is that we've seen the insights from the kind of collaborative innovation literature are really valuable as strategies for success here, concentrating on enhancing that collaborative potential of the system and doing that through bringing people together around a common goal, helping partners to work together and helping partners to think differently. We've seen them implementing that in order to improve that collaborative potential. And then for social innovations, we have the relationships with like-minded individuals that are really central to launching and implementing, but over time shifting to relationships with organizations who share the same goals. And here is the insights really from the social innovation literature that are valuable as strategies for success. So that idea of focusing on building an ecosystem that the innovation community needs to support its members and to make them successful to really flourish and grow the innovation. Okay, so just wrapping up then, I didn't move on. Just wrapping up then, what's the value of the innovation journeys and these three innovation journeys, but also this concept? So I think it really helps to clarify how different actors in a system can be sources of innovation. So particularly interesting that example of the care providers actually moving to become a kind of user innovator. It's useful for providing the care sector and organisations with potentially much more nuanced insights about what to expect and what strategies to employ. If you can identify what type of journey you're on, then you can employ the right strategies for success. We also hope that the diagrams that we produced and this kind of illustration of how those journeys proceed become a bit of a scaffold for telling stories about specific types of innovation journeys and sharing learning and identifying how to proceed. But I would also argue that perhaps hopefully we've been able to show that the innovation journey is a useful unifying framework for thinking about innovation in this context, particularly by demonstrating that read across to those different innovation literatures. It can show how it can really enhance our understanding of how these different ideas connect, come together around some common themes, but perhaps there are some important differences in terms of thinking at strategies. And then I think there are some potentially quite interesting implications for policy around particularly the business model and systems innovations. So what we thought was quite interesting, that was notable, that there wasn't really very much attention in those two different types of innovations to the spread of the solutions related to the kind of combinate how you combine the innovations and integrate them into the context. We were wondering whether the knowledge around that is particularly sticky and too difficult or time consuming to spread. And so thinking about from a policy perspective, how could spread of this knowledge be supported? And then also that example of WCS becoming a user innovator is interesting, and thinking about, well, to what extent is this common in the sector, and to what extent perhaps should we be facilitating and supporting this if there is knowledge that's sitting with those care providers, with those users in a sense, that's not being picked up by suppliers and utilized to develop products that really work for them. Okay, so just to acknowledge that the wider team, and then to thank you. So that's the end.
Thank you, Juliet.
Should we
Okay,
do
so
question and answer now, Juliet, do you think, or leave it a little
I
bit towards
if
the
there are,
end?
I think I would suggest that we do it at
Yeah.
the end for
Okay.
both presentations,
Okay.
and maybe if anyone has any specific questions for Juliet, put them in the chat just to make sure we have enough time. And I think our next presentations are from Cheryl
Great.
Chui and Tracy Lu from Hong Kong University. If you'd like to start
Are you
sharing and
able
introduce
to
yourselves.
see my screen? Should be able to. Yes. Okay,
Perfect.
so thank you very much, and thanks, Juliet, for that wonderful presentation. Of course, following you, let me introduce myself first. I'm Cheryl Choi. I'm the Associate Professor here at the Department of Social Work and Social Administration at the University of Hong Kong. And together with me today is my colleague, Tracy Lu, Assistant Professor also at the same department. So following Juliet's presentation, she's obviously done a great job on laying out some of the conceptual paradigms through which how we can think about innovation. And of course, presenting from the other side of the world here, we will be speaking more of the second dimension of this global group in innovation, but also speaking to some of the innovation journeys that she's talked about just now. So what we're going to do today is, as you can see on the screen, I will actually speak a little bit more about the normative principles of innovations, whereas Julia, of course, spoke on, based on case studies on the different journeys of innovations by business, systems innovation, as well as social innovation. Here, I want to set the scene a little bit more on the normative principles of what innovation is and what it should be and who is it for. And then we will go a little bit, for those of you who are not familiar with the Hong Kong context, especially in the long-term care system here, I'll give a brief background on what's it like in the city. And then I'll pass my time to Tracy, who would go on to actually speak to some of the case studies and the interventions via Timebanking as one of such illustration of innovation that we've observed in the city in the past few years that is emerging to be one of the quite a promising new approach in thinking about how we divide up responsibilities between the government, service providers, as well as users, and how that may reshape how we think about long-term care systems. Okay, so again, welcome any questions and queries, collaborations afterwards. So just to lay out the scene again, this is taken from the social innovation literature, but I think it's quite useful in setting the stage in terms of how we've thought about innovation. And of course, it has in essence, on the left, you see a definition about how it needs to be somewhat novel compared to existing solutions. So in a sense, why innovate if it's not better compared to existing solutions? But again, later on, I would be questioning and also welcome discussion about who defines what's better for whom, and also how is it better. So those kinds of parameters actually does not involve simply cost efficiency kind of parameters, but also some normative discussions around the idea of innovation. And in reality, of course, how do we see innovation? And it's two different things, or it could be both. The first is about product innovation. So this is, of course, much more observable in terms of during technology. We see a lot of robotics, AI even, and how that's revolutionizing or at least drastically changing about how we view service or service products. Robot companions and so forth. Something of that sort is completely unprecedented in human history, and how we think about healthy aging and what the role of innovation could play. And the latter one is about managing relationships. So I think that's also speak to what Juliet has just presented with us, thinking about how we restructure some of the roles and responsibilities across different stakeholders in society as a way of process innovation that could, again, collectively change the way we think about long-term care system. And of course, we're presenting in Hong Kong being one of the gateways between East and West, how culture plays into that. So again, discussing the idea around what could be universally applied versus in terms of implementation, what needs to be culturally adapted. So to talk more a little bit on what was said earlier on, laying out some of the principles, the normative principles revolving around innovation. So these are just based on a previous study that I've conducted, not necessarily on long-term care exclusively, but just asking people and collecting information from service providers as well as different service users on what is innovation for? What are the principal parameters that should govern innovation? And basically came up with 3 principles that we again want to lay out here. And the first is about innovation being necessary to capitalize on existing resources, meaning that because we recognize that we've for a very long time thought about professional services as being a very top-down, hierarchical, professionally driven model. But we've realized that actually there's a lot of collective wisdom that have been untapped, unharnessed, underutilized in the community. So that's why the first principle, again, that innovation, again, should, and at the very best, at all times, be capitalizing and drawing from existing resources and wisdoms that are inherent in all communities. So that's principle 1. The second principle is speaking about affordability and scalability. So this really has to do with the question when we contend with who are we innovating for? Who can afford this innovation? Are we innovating simply for the top 1% of the population, or is this scalable, that it could benefit and reduce old age inequality? And here again, we also want to reduce cognitive load. Something that is innovative and useful for us may be differently perceived or received differently, depending on different dimensions. And then the third, of course, is it needs to be context sensitive. So as we read a lot of literature, and also, as Juliet mentioned, not all innovation succeeds, so to speak, and there's a lot of lessons to be learned from innovative failures, but there's a lack of understanding from literature, because most of what we actually, including ourselves here, we study are enabling or success cases where there are positive outcomes. But what about those failures? What are the pitfalls, and what are the protective as well as debilitating factors that may lead to innovations being able to scale up, accepted by the public versus not? So those are some of the outlined key principles of innovations that we could circle back later on. And now I will move on to the long-term care system in Hong Kong. Again, this is very small, tiny geographic location compared to the UK. We're only about 1,100 kilometers square with a population of around 7.5 million. So just to give you all a background of the city, we are undergoing very, very, very rapid population aging. So compared to the West, actually, you had about 100 years, a few hundred years to age. We are actually aging within one generation, 2 generations. So by 2049, actually, in a city of around 7.5 million, 1 in 3 of us will be around 65 years old or above. But at the same time, we actually have a lot of wealth in the city. So I want to highlight this, as you could see, in addition to population aging, we actually have a lot of wealth in the city. But how is that channeled in a way that could benefit population aging? And later on, I would, again, through our case study, would highlight that a lot of our innovation actually comes from these very large base trust funds, charities trust funds in collaboration with universities. And then for the long-term care system, again, in the city, it's quite archaic. It's called elderly services. So we're mindful of the language here, but the official term here is the elderly services. Its guiding principles are twofold. So the government, the Hong Kong government also, of course, adhere to and also promote aging in place, and then the continuum of care, depending on the needs level of the service users, primarily divided into 2 large categories. The first is community care and support services. So we call these CSS, and residential care services. So it's self-explanatory. Community-based care are those for older adults still living in the community, whereas residential care services are those that are provided to service users who are living in these residential services that are tailor-made for older adults. So most of the support services, both community care and residential care service, are provided by nonprofit organizations in Hong Kong. And there are some private sector involvement as well, especially for residential care services. So the key message here to take away within the system, in connection with the long-term care system, is that typically the Hong Kong government would subsidize or contract out some of these services, and then they will be carried out and implemented by NPOs, non-profit organizations. There is also an increased emphasis on consumer-directed care. So we've piloted about a decade ago on consumer vouchers, where we believe that users may be more apt to be able to have the choice and right to make their own decisions about their own healthcare and support care that they need. Okay, so circling back into today's, of course, seminar here, webinar on innovation, there is always a quest for innovation within the long-term care system in this city as well. Here, we do notice a distinct shift from a more professionally driven approach towards innovation, towards kind of spreading out the responsibilities of long-term care to a more collective responsibility approach, where constant questions are being asked in terms of what the roles can be for other community stakeholders. So we want to advocate for, and also the direction is really place-based innovations, where we're constantly questioning and also brainstorming about how different types of community stakeholders, like you see here on the left-hand side on the diagram, about what the role of trust and philanthropy can play in this innovation in the context of long-term care can be. What is the role of higher education institutions, service providers, and government support? And of course, service users themselves. So who's innovating and how is it done? I will pass later on to my colleague Tracy to speak more about this. But the last thing I would say before passing on my time to Tracy is that the government itself also has some policy support to incentivize innovation to take place within the long-term care system. So there are funding support like the Social Innovation and Entrepreneurship Development Fund that allows for different stakeholders in society, including nonprofits, individual social enterprises, businesses, to actually apply for some government seed money for them to pilot innovation. But again, I think as we progress in this group, we would be able to see a lot of experiments being tried, but not all tried and succeed. So that's something, again, that we could learn from each other. And I look forward to learning from all of you later on as well. So without further ado, I think I'll pass my time to Tracy, and she'll be again speaking to us more about some of the case examples of time banking and how that has substantially reshaped how we think about aging and the roles and responsibilities of different community stakeholders in contributing in the long-term care system. Okay.
Thanks, Cheryl.
Yeah.
Thanks, Cheryl. So to summarize what happened in the long-term care system in the Hong Kong, and we actually observed several structural mismatch between the traditional social care models and new dynamics in the aging populations. So from the individual level, as pointed out by Cheryl, we observed that older adults are positioned as the passive recipients of the care and the service because we're still adopting professional service model. And at the community level, the support it is delivered as the one-dimensional transition from the professionals to the individuals. However, that kind of approach with quite limited reciprocity opportunity and the peer support exchange. And at the service system level, we also observe that the service design and delivery are dominated by the professional workforce model with limited users' participation or co-creations. However, when you observed the aging population's cohort, we actually see the growing proportions of the baby boomers in the coming few decades, and that they are quite compared with the previous generation. This is a growing, healthier cohort, seek purpose and meaningful engagement. And the baby boomers increasingly seek mutual support and meaningful social connections in order to combat social isolations and the loneliness. And the baby boomers also expect to shape and influence the service design so that to reflect their diverse interests and capacities and the life experience. In other words, we are actually using the traditional service model that reinforce a dependency-oriented society instead of creating the enabling one. Yes, please, Cheryl. So when we look at the existing innovations across the Hong Kong, we actually observe Timebank as a promising social innovations to the long-term care systems. So mainly focused on community-based and home care service. Exactly, Timebank transformed the older adult from the passive recipients to the co-productive agencies. So I don't know whether you are familiar with Timebank or not. So Timebank is a community-based social exchange systems where time, not money, is the currency. So which means that you use time to exchange service instead of use the cash. So the Timebank focus on the 5 core values, including everyone is an asset. No matter you are with the functional limitations or low income or low education, still are regarded as assets to be untapped to contribute to the community. So number two, it is that the time bank redefined the work by creating the mutual support system to give the time credit to each hour of the community contribution. And the time bank also focused on reciprocity, social network, and respect. Later on, we will explain more. So within the time bank, individuals earn time credit by providing the service like simple home maintenance and cleaning and medical escort. And then individuals can exchange those time credit for the help from others. Most importantly, the time bank emphasized the equality, which means that each hour of the service is valued equally. So which means that, for example, Cheryl can contribute 1 hour of the contributions to the community, and that kind of the value actually exactly equally the same with the older adults. And another beauty of the time bank is that it focuses on a cumulative value model, which means that individuals can earn time credit when they are healthy, active, and safe, and spend them later during the times of needing. And the time bank quite different from the traditional volunteerism model, which the later on focus on one-dimensional charity model. However, in the reality, actually, time bank can combine volunteering model and the time bank mutual support model. So we have a many beautiful names for the individuals within the time bank. We create the names of the prosumers, which it is combinations of the producers and the consumers. So time bank actually have been recommended by the WHO in the decade of the healthy aging as one of the promising interventions to promoting active aging and contribute to the societies. And it is also promoted as one of the major components of the social prescriptions to improving well-being. And then there's international and local evidence to support the effectiveness of the time bank in order to improving the healthy aging. Next. So time bank it is not a new concept. Actually, this concept can be traced back to the 1970s. So this time bank process it is proposed by a Japanese lady, Mitsushima, in the 1973. So Mitsushima come up with the time bank concept in order to save to help the middle age of the women who have the responsibility to take care of the elderly parents. So the time bank created by Mitsushima in order to create mutual support system for the young ladies. So during the 1980s and the 2010s, there's experience of the growth and maturations of the time bank. So the American scholars, Dr. Ken, actually formally proposed the concepts of time banking in the 1980s, and then to emphasize the core values of time banking that we mentioned before. And in 1993, Time Bank USA have already set up to propose to advocate the movement of the time bank. And later on, there's a time bank UK, and then Australia and Taiwan also set up the time bank systems and the platforms. And later on in 2010, after 2010, we witnessed the expansions and the evidence accumulations on the effectiveness on the time bank on health, social capital, and other healthy aging outcomes. Especially during the COVID-19, and time bank also proposed as innovations to combat loneliness and social isolations. There's a quite quick overview of the time bank globally, but I won't go into detail. So in Hong Kong, since 2019, especially when the Hong Kong government encouraged the nonprofit organizations to launch the time bank innovations. Since 2019, there are around 30 projects related to time bank across Hong Kong, covering 20,000 participants, and per time bank there with 300 to 1,000 participants. So within the time bank, mainly the participants are older adults with the participations from the women and the youth. and the time credit activities including the home and community-based service. And the individuals can earn the time credit through the medical escort provided to the PS in need, very simple home cleaning, and the social companionship. And the individuals can also exchange the time credit for the mutual support service and then to participate into personal growth activities. Within each Timebank project, there is quite unique governance, which means the majority of the Timebank project adopts the bottom-up approach in design and the decisions-making process, which means that within the Timebank, there's a group of the people that from the older adults, they as the members of the Timebank, but also come together to discuss the development of the service and what kind of the preference should be reflected in the design of Timebank. So there's 3 models within the Timebank in Hong Kong: person-to-person exchange and community-based service with the light training, which means that the older adult maybe have the light paraprofessional training, and then they can work as the paraprofessional care workforce to supplement the community-based and home-based service. So in Hong Kong, I want to supplement it is that even though Hong Kong long-term care system, it is funded by Hong Kong government, and the older adult in need need to undergo the standardized care need assessment mechanisms based on their current health situations. However, due to the limited public funding and the limited care workforce, they have to wait at least half years to get the service. So which means that during the assessment, it is focused on their current status. However, they have to wait at least half year. So this is a huge service gap. So that's why there's many innovations related to Timebank to come up with and then train up the healthy older adult and then equip them with the paraprofessionals skills and then try to fill up the service gaps. Another service model related to social enterprise and the community economy, but I won't go into details. So it is quite another story about this picture. So I would like to quickly to point out several cases that conducted by our colleagues and by our team. So one of the case studies related to person-to-person exchange, and that kind of the complex Timebank project was launched in the 2017, and then there's over 1,000 of the members, including older adults, and that Timebank actually facilitates the social service exchange. And one of our colleagues conducted evaluation study and with the course experimental design with the one intervention group and control group. And after comparing 2 groups' health outcome, key findings including the intervention group experienced significant improvement in the physical health and the psychological health. Psychological health remained stable, and the intervention group compared with control group, they also show the enhanced self of their self-worth. So to give you more details about how Timebank work, we also give you the second case studies. So this case study related to the Good Hands. So it is the Good Hands collaborated with a professional association. So actually that kind of professional association with a huge group of the retired professionals. And the social service organizations, they have also have a large number of the care recipients waiting for the government-funded community-based and home-based service. And the social service organizations, actually train up with the batch of the retired older adults to provide the following service: escort and shopping, and social company, home visits, and also equipped the older adult with the professional training in order to deliver necessities. And the older adult who volunteer within this Timebank project, they can get reward. They can use the time credit to enhance their skills. So that kind of skills is also related to home-based and care, community-based caring capacity. And they, of course, they can exchange the time credit for free haircut, day trip, and the workshops that related to self-help management. The third case study related to the Jockey-funded age-friendly Timebank project that it is conducted by our team. So our team conducts the course experimental study design and then have the two groups. One is Timebank group and another is comparison group. So both groups have the training and the volunteer opportunities. We specifically provide the training relative to the frailty, dementia, and the elderly depressions, so that to equip older adults who want to involved into this Timebank project can able to act as paraprofessionals, care force for the community. And we also collaborated with the Department of the Computer Science to develop the HinCare app. So this is a mobile app that can be accessed by the older adult for the both intervention group and control group. So basically, we designed the intervention for the Timebank through the following features. Number one, it is that the older adult within the Timebank, they can register the volunteer opportunities and then to exchange the service using their mobile phone app. And then their time credit can be automatically transferred into the time credit. And then they can use the time credit to exchange the service provided by social enterprise. And third, that kind of approach actually emphasizes autonomy. So there's some details about the design of the service, but we won't go into detail. The next slide shows the effectiveness of the Timebank project in improving the civil engagement and the volunteering. So the key finding, I know there's many charts here, but I want to highlight some key finding. The Timebank significantly increased the older participants' volunteer hours within the program itself. Importantly, Timebank did not reduce their involvement in the external volunteer activities. So this means that Timebank adds values without replacing other forms of volunteering. And Timebank have particularly strong effect for the certain groups, including older adults age 65 and above, individuals with low education attainment, and the people with multiple chronic conditions. Next, please. So we also to investigate the impact of the Timebank on the capacity building, social capital, and health. Just highlight in the red color, we actually find out some direct and indirect effect of the Timebank in improving the self-efficacy in the volunteering, improving the social network, and then Timebank also improve the perceived health gain from the volunteering. So which means that actually through the participation within the Timebank, older adults, even though they participate as the paraprofessionals to the community service, they actually also enjoy the health benefit. To summarize, not yet summarize. So we also conduct the qualitative study to understand the perceived importance of the role of the time credit, which shows in the next slide. So basically, we conduct quite a lot of focus group interviews with older adults. So basically, to ask what's the role of the time credit for them. So number one, there's the three roles of the time credit highlight in the older adults as the co-producers and also perceived by the social workers who work together with these older adults to deliver community-based and home-based service. So number one, this is a symbolic currency. So Timebanking's volunteers may mentally distinguish time credit from the traditional monetary incentive. Instead, the volunteers, especially older, that perceive time credit is the tokens and the symbolic currency. So this is very important because through the time credit, actually they can see the the time credit actually increase in their app, mobile app. It is kind of their money or their small success increase through their bank account. But it is not commercial bank account. It is their community time bank account. So number two, it is that time credit, it is kind of the organizational recognitions. It facilitates the role transformations from the charity to mutual appreciations. When we talk with the older adults and when we have the focus group interview with the older adult, it is very powerful innovation tools because in the East Asia society, when older adults need help, they are quite reluctant to share their to share their difficulties and then to ask for help. However, using the time credit, they can gain more resources or additional resources. And when they ask for help through the time bank, actually they feel they're worth it because they earn it, right? And the third role of the time credit, it is kind of the self-reinforcing the circle of the community engagement. Through the time credit, acting as a role engagement also within the time bank, within to provide the social support, that kind of creating the productive and the supportive environment that reinforce the community engagement. To summarize, we can see some key implications through the time bank innovations. The first one is that ODLWs are no longer viewed as the consumers or purchasing or consuming the professional service from the service provider in the market model or in the public welfare service model. Instead, they are the contributors. They are the co-producers, meeting the demand resulting from the population aging. And that kind of approach offsets the over-reliance on the professional resources and also enhance society's sustainability in meeting long-term care demands. When we talk about the structural mismatch, we find out the time bank have the potentials to solve the structural mismatch. Number one, in the individual level, it activates the role transformation. At the community level, time bank fosters reciprocal exchange and social cohesion. And at the service system level, it enables set-up co-productions in order to including co-delivery, co-design, and co-decision making with the professionals. So I pass the time to Cheryl to give us the conclusions.
I think, thank you so much, Tracy, and Julia as well. The takeaway from all this, again, it's a idea of shifting relationships and responsibilities about who can innovate and who can contribute and who is the consumer. And I think what we're trying to illustrate here is that through time banking, we could see a reconfiguration of these seemingly or previously non-malleable relationships and divisions that actually can be malleable, but also very messy in the same time. So we're still at trial and error. And also, I think speaking to this group is to how to then scale this innovation in a way that could be on the citywide level. So it is a messy, but again, a great learning process. It does show a lot of promising results, especially with validating, maintaining older adults' health, civic engagement, and also their continuous consumption of when they need it, the long-term care services. We also would be then exploring again the role of trusted intermediaries. So as you see earlier on, different diagrams shown throughout the time bank case, it's actually a lot of arrows between different stakeholders, service providers, government, intermediaries, such as universities. So what are the enabling factors then to ensure, so what is the magic pill or magic powder, magic potions that would actually be able to build an ecosystem in a way that facilitates and fosters this kinds of innovations? Because of course, time banks alone is just one example of 1,000 different ways of innovations, as we think. And this I already circled back earlier, which is less is known about what doesn't work. But I think as much lessons could be learned from failures than there are with successes. So I'm mindful of the time, so we will stop here and we welcome questions. If you do want to, so these are our email addresses. I'm happy to hear your thoughts and join us as well in the group. Thank you.
Thank you. We've got only a couple of minutes. There is a question at the chat, in the chat about the role of international organizations and who pays. I wonder if you could give a very quick answer, one of you, and thank you. Yeah.
The role of international organizations in Innovate. So it was about the role of governments, wasn't it, in this? And I suppose that promote particular types of approaches to innovation, wasn't it? And I mean, I suppose.
Yeah, there's also been a lot of European funding that has motivated a lot of innovation in different European countries recently. I think that may be the background of the question.
Yeah. And I mean, I suppose, so I think what we see is a lot of innovation is sort of the type of innovation that Cheryl was describing, where you have sort of new services, new types of organization popping up, often with that sort of more of a social movement behind it, sort of social, as we call them, sort of social innovations. I suppose, which is great. And it's great that money is put into the development of that. And that's a good thing. I suppose the difficulty, if that is the only approach to supporting innovation, is that it misses really the role, I think, particularly in the UK, but it will probably be similar in other countries, the role of local government, that they have a particular position that they have in the system. And also those kind of care providers who perhaps operating on more commercial basis and the role that they have in innovating and sort of changing the business model and practices. So I suppose what I would like to see is something that's a little bit more diversified in its approach, that recognizes that there are different things that we might want to be doing, or different things that we might want to be thinking about as governments, and as other players in the system, to support other kind of parts and players in the system to innovate in particular things that they're trying to do. So transform across systems seems to require something very different to just thinking about how you build another social innovation.
And maybe a quick last word from Cheryl and Tracy, because we'll have to end.
No, I think Juliet, covered it. Yeah.
Okay,
It's a
so
lot
then
of it,
from our
but
side,
very enriching discussion.
yeah. Well, I think it's been absolutely fascinating, and thank you both, the three of you, for such also in-depth presentations and giving us such a good idea of both how the process of innovation works, and then being able to also look at an evaluation of an innovation and its role in the wider ecosystems of volunteering. So thank you very much. Please make sure you stay up to date by joining the Observatory, and you can always write to us, and then we can put you in touch with Juliet, Cheryl, and Tracy, and we will be sharing a recording of this webinar and the slides. And thank you, and wishing you the best for the rest of your day, or good night if you're in Hong Kong. Thanks.
Thank you.
Thank you very much. And do get in touch with us.
Yeah, especially with future topics
do.
that you'd like to explore further or want to hear more about. Thank
Thank
you.
you. Bye.